Hello, it's Bonnie Southgate here again. We are here today to talk about shoulders. So shoulders are obviously one of the areas that hypermobiles can struggle with the most. I personally have had many dislocations and subluxations on both shoulders, and for years really struggled with it. So I'm going to share with you the things that made all the difference, because I spent many years really frustrated trying to do exercises that I was given, and really just not getting anywhere. So on one of my courses that I went on, a CPD course, I learned a really simple technique to screen the rotator cuff. So your shoulders are really held stable by your rotator cuff. And there's other elements that I'll talk about in a minute. And very commonly we get imbalances in the rotator cuff muscles, and when we get an imbalance, it can pull the ball out of the socket, and when we go to move, it doesn't hold it centrally in the joint. So it's just one element. There's many elements to the shoulders, but it's one element that was really helpful for me. So I'm going to show you a really simple screen to evaluate your shoulder muscles. So first, we'll talk a little bit about the rotator cuff muscles. In the back of your shoulder, say you have a muscle that comes across here, and it attaches to your arm bone, your humerus, and it's called your infraspinatus. And the job of this muscle is to rotate the arm out. So it externally rotates the arm. It also helps to make that movement a little bit with the arm. So it basically will do that kind of movement. Often, as a hypermobile, that muscle can get a little bit tight. When it does, it can pop the ball out forward, and that's not ideal. So that's one of the muscles that often can cause trouble, but we don't really know unless we screen our shoulders which ones are problematic. And I think a lot of times people can jump to conclusions, and I think there's standard exercises they give for rotator cuff muscles, but they're not really specific enough for somebody who has dislocating shoulders. So that's one muscle. There's another muscle, and it's called your subscapularis, and it's in charge of rotating the arm in and sort of making a little bit of that motion. And you can't see or palpate that muscle because it attaches to the scapula, but it attaches to the shoulder blade or scapula in between your ribs and the scapula. So it's really internal in there. And that muscle comes around, so from under here, and it attaches to the front of your arm. So that one pulls it that way, and the other one pulls it that way, because one attaches to the front and one attaches to the back. So those are two of your rotator cuff muscles that are just helping with keeping it stable in the socket with internal and external rotation. You then have another rotator cuff muscle, and it sits, if you feel your shoulder blade, you can feel that you've got a ridge of the bone. And so the infraspinatus sits under the ridge, and then you have a muscle called your supraspinatus, and it sits on top of the ridge, and that's why it's called supra. And it comes down under a gap here, and then it attaches to the arm. So you can think that your supraspinatus is in the middle, and then you've got your infraspinatus, and then you've got your subscapularis, and then you've got another one which is called your teres minor, and it comes a little bit more. So if you think about where the armpit is, it angles, it's underneath your infraspinatus, and it also helps with that external rotation. So we've got more muscles with that external rotation, really, that influence the humeral head. We've got other muscles that influence internal rotation, but we'll talk about that a little bit later. So one of the things that I found really useful in my shoulders, and I'm going to show you because I don't have great shoulders, generally speaking, and I screen them most days, and I do this exercise, and I can move them around. I feel completely stable now. But before, if I was to reach my arm forward, my arm would come out of the joint. I used to wake up in the morning with this one hanging down. So I am going to just take your arms. When you take your arms up, you should lead with your thumbs. It is wrong to lead with your little fingers. That is not how the arms should move. You should be moving them that way. So your supraspinatus, this one here, it initiates the lift of the arm, and it initiates it with a teeny bit of external rotation. So a little tiny bit, and it should be what starts to bring your arm up. So you can be thinking about that. You don't want to be lifting your shoulder. You don't, when you lift your arm, you want to watch that it doesn't get pulled down to lift it. So that'll be your overactivity in something called your latissimus dorsi, and that can end up subluxing your shoulder down. So if you feel like when you start to lift your arm up, it wants to nosedive down, I want you to take the other hand and just hold this up and don't let it nosedive down. So just start it there. Now you're going to take it to where it's comfortable. If you can get to here, this level, and you're comfortable in your shoulders, also thinking about not having your shoulders back there, because then I'm gapping the joint. That's not a good position. This position here is called scaption. Should be 30 degrees forward of the side of your body. So if I'm there, I'm going to start to rotate my arms in, and I want you just to look at my shoulders gently as I rotate them in. You can see my left shoulder lifting up. So my right one isn't lifting up, but my left one is. That means my muscle in back is a bit tight or a bit held or a bit in spasm because it's not letting go and letting my arm internally rotate. So I know that's a little bit of a problem. So that could be a little instability problem. So question is, what do I do about it? So I have two options. I can either take my hand or I can take a ball, like a tennis ball or another ball. I find the ridge on my shoulder blade and I go below it. And I can find a tender spot. So I can either hold my hand in there very lightly. So when you're going to do a trigger point as a hypermobile, you need to push into the spot that's sore. And if you give it a scale out of 1 to 10, you want to go to about a 6 and no higher. And then as you hold it there, you want to wait until it relaxes. If you push and it's too painful, if you don't know what 6 out of 10 is, go lighter, not heavier. It should start to ease over time. And if you feel that you're getting a referral of nerve down your arm, just move your finger off and change your position of your finger, because you might be pressing a nerve and that's not great. So I can feel that's easing a little bit. So that's one way you can do it. Another way is to do what we call an MET. So for spinatus, an MET I like to do, I do at the wall. So what I'd like to show you now is a post-isometric relaxation technique for the infraspinatus, or an MET. You need to find a bit of space in your house, wherever you are, where you have a little bit of wall for this. So you're going to take your elbow into the wall, have this part of the arm into the wall, not the bony bit. So placing your arm on the wall there, and you're going to let the arm internally rotate. So it's going to go down as far as it can very comfortably go without your shoulder feeling like it's compromised. Taking this hand on top, you're going to use this hand as resistance because you're going to be pushing the hand up and into the wall. So you very gently push the hand up and the elbow into the wall. And this is 10% effort, absolutely no more. Really lightly, hold it there for 3 or 4 seconds, and then let it internally rotate to where it's comfortable. So don't push it, let it just drop down. And you're going to repeat that again. So you're going to reach the elbow into the wall and then push the hand up. And you're going to hold it there for 4 or 5 seconds. And then relax and let it drop down again. So you can see my arm is starting to internally rotate as that muscle is starting to let go and back. Reach again into the wall, gently push the hand up. And relax. Right, so once I've done that, I'll screen my shoulder again. So if I take my hands out and I roll them in, we can see that that shoulder is no longer lifting up like it is. So that muscle has sort of gone into a reset mode and is in better function. And now to take it further, I'm going to strengthen the opposite rotator cuff muscle. So I'm going to do some internal rotation of my arm. I've got a band at home. If you haven't got a band, then just do it with your hand. You can also, as you come in, start to press into the other arm, so you give yourself a little bit of resistance that way. As I do this little exercise, I should feel that the ball gets sucked back in the socket, which I can feel it doing on my arm. So whether you are with a band or without a band, you want to feel that the ball rotates back. You can almost see it going back into the socket. If it starts to pop forward, then you haven't got the placement correct. So taking that band here on the chair, and then gently, I'm going to always have my hand on what we call the humeral head, or the ball in the socket, so I can feel where it is, what it's doing. At no point does it want to be popping out that way. So I'm going to bring that arm in, and I can feel it being sucked back into the socket a little bit, and then relax. So that would be how you would deal with a bit of tension in the muscle and back called the infraspinatus. So now what we want to look at is the subscapularis, because that's the opposite muscle, and we can have dysfunction there. So hypermobiles fall into a unique category where their shoulders can dislocate in either direction. Most commonly, dislocations happen forward or anterior, but it's definitely not unknown for it to go backwards in a hypermobile. So I've had shoulder dislocations on both arms, but they tend to go in opposite directions. And you can almost see that this one goes back, that one goes forward. So when I go to screen my arms this time, rather than rolling my hands in, I'm going to roll my hands out. So you can see my fingers are a bit too wide. I've got more for my arms, that's why. So we roll those arms all the way out. And as we do that, you can see that my right shoulder on this occasion wants to lift up, and my left one is fine. So I know that I've got a little bit of tension in that subscapularis, which we talked about is in between the shoulder blade and the rib. So it sits on the anterior side and comes around and attaches to here. So I'm going to do exactly the same thing, protocol. I'm going to use an MET, post-isometric relaxation technique, and then I'm going to follow it with an exercise in the opposite direction. So for this one, you really need to, I'm going to just face the wall here. You need to have your arm here, and you need to take it as far into external rotation as you comfortably can go. So I've got my hand here, and I'm going to push my hand into the wall, and I'm going to draw my elbow down just a teeny bit. And then I'm going to relax, and I'm going to see if I can externally rotate it a little bit more. And I'm going to do the same thing. I'm pushing my hand into the wall and down, and then relax. And then I'm going to take my clini band, and I'm going to do the opposite exercise. I'm going to take my palm up, so I'm in external rotation, and I'm going to take that hand out. So you can either have the elbow dropped into your side, or you can have the elbow up. So if your elbow is up, it focuses more on the infraspinatus that we talked about. If the elbow is down, it focuses more on the teres minor. Neither is wrong. Probably good to do a little bit of both if you found that that was the way that your shoulder was showing dysfunction. So rotating that arm out, or taking it up here and rotating it out that way. I'm going to show you some exercises to help strengthen your supraspinatus. Anyone who's had a dislocation, pretty much this will be a little bit loose because it's allowed it to hang out of the joint. So really, realistically, you need some form of resistance, a little clini band. If you don't have a clini band, or if your shoulders are really, really bad, then I will just tend to take my hand down by my side, and I very gently push into the wall. That's it. All you need to do is just push into the wall, or you can go in between door frames. I know there's an old child's thing where you push out into the door and then your arms float up. That will be helping your supraspinatus and your deltoid with your arms. So you can take your hand into the wall, very gently pushing out, and relax. If you're okay doing that and your shoulder feels all right, then or you have a clini band at home, then you're going to stand on your band. So as I said in my last video, the supraspinatus very tiny, has a little tiny bit of external rotation. Not that I want you to think about really rotating your arm out, but if your palms are facing back to start with, I want you to just make sure your thumb faces forward. And then you're just literally taking your arm to there. And I want you to take your other hand on top and here and feel like you've got a suction. It might feel like you're doing nothing, and then relax. And again, you're going to take the arm there and you're going to suction it. So what you're looking for, I'll show you with my shoulder. You've got your collarbone that comes across here and you're coming. If I pull down, you can see that I've got that gap going on. And some of you, if your shoulders are really unstable, might live there. So we're trying to get that suction from there back to there. We're not elevating the shoulder there. We're just getting that little bit of suction coming up. So even just holding my arm here, I can start to just feel like I'm just pulling that bone up, and that will be just getting, you can just see that little exercise there, the humeral head back into the socket where it belongs. If you're really tight in your lats, it might make that difficult to do. So if your shoulder is jammed down or you're jammed down in your ribs, you need to try and lift up through here before you get that little sense of suction coming up. And you can do even an elevation of the shoulder, hold the arm and suction up. But it's better if you can be in a nice neutral position. I want you, when you do these exercises, to really pay attention to your ribs and not let yourself collapse in sideways when you're doing the exercises. You want to try your best to imagine you've got two rods coming down the side of your body as you try and bring the arm up into the socket. Now we're going to go on to some other muscles that are more in the front and the back and come around the ribs. And these muscles influence your shoulder blades. So one of the really important things as a hypermobile you need to think about is that your arm does need centering in the socket, but also that the actual socket for your arm bone is your shoulder blade. It's your scapula. So whatever that does, the arm needs to follow it, because if it doesn't, you'll be separating the joint from the shoulder blade. So when people go to lift their arms or they go to do things, it's really easy as an extreme hypermobile to move the arm without moving the shoulder blade. So we're going to start with just a little exercise lying down. So now we're going to be looking at a muscle called serratus anterior. And we're also going to look at just moving the arm in the socket. So the socket, as we've said before, is your shoulder blade, and it's really important then that you think about the two bones moving together. They don't move separately. So if I lie on my back, I'm going to just bend my elbow, which is going to make my lever shorter, which is fine. If you cannot lie here without that arm bone popping out forward, then get yourself a cushion and on here and rest your arm there, and that will keep the arm in a better place. So you're going to start with the arm here, and one of the reasons I'm doing that is, as a hypermobile, most of you will love to hyperextend your elbows, and a bit like the leg bones, it means that this bone is going that way and that bone is going that way. So now if we bring your arm here, we're bringing those bones back into alignment a bit. So as you start here, I want you to start to float the elbow off. And as you do, feel that the ball drops back in the socket. But I now want you, I'm going to take this away. I want you to take your shoulder blade, and I want you to feel like you widen the shoulder blade and then relax. So you're taking your hands really on until you can feel the inside of the shoulder blade. With the other arm, be careful not to dislocate that one. If you can't reach that arm across, then that's fine. Don't. Just try and feel that actually when you reach, you're allowing the shoulder blade to roll around the ribs to lift the arm up, and then relax it back down. And again, you're taking that shoulder blade and you're gliding it up and bring it back down. And I'm going to do a few on the other side because it feels quite nice to do that. I get a little bit tight in between my shoulder blades, and I can reach that shoulder blade up and bring it back down and reach and bring it back down. Now, if you found that wasn't too bad, you can lengthen the lever. I want your palms facing one another. And now you're going to reach from your shoulder blade. And then you're going to allow the shoulder blade to come back and the arm follows the shoulder blade. And again, the shoulder blade is leading up. And then the shoulder blade brings the arm back. Good. And now we're going to start to take our arms over our head. And as we take, you can shorten the lever again. As we take the arms over our head, the shoulder blade should move again. And it should move in that kind of direction. So as the arm goes back, the socket should be going in the same direction. So my shoulder blade here, or if that's the back of my shoulder blade, will start to do that as I lift my arm to the side or over my head. So I can feel that my shoulder blade is widening at the bottom. And I can feel that I'm almost reaching out through my elbow, but from here. I'm not reaching my arm out of the socket. It's all moving together. And then when I bring it back down, that shoulder blade needs to come back with the arm coming back. And again, you can lift it up and you can feel that shoulder blade. Feel the bottom end of the shoulder blade moving out around your ribs to the side. So the bottom of the shoulder blade wants to end up almost around the side of your body. And then as the arm comes back down, the shoulder blade comes back. And again, it's important it doesn't get stuck there either. And so it comes to there, and then it comes all the way back down. And so if you found that you can do that, and that's all right, you can move on to a little exercise where you take your fingertips behind you. So I'm thinking about that sense of that shoulder blade wrapping around towards my chest. And I'm relaxing my collarbones. So what I don't want you to do is tighten the muscles here. So sometimes when people lift their arms, they really tighten in their chest muscles. Think about your collarbones sinking back into your chest. So we've got the arms here, and we're just going to walk the arms up a little bit. And you're thinking the whole time about that connection of the shoulder blade and the arm. I'm not going to go any higher than that. When I get to there, I need to let go of the muscles here. So I need to let go of the muscles in my armpit. And then I'm going to walk my hand back and bring my arms down. So you can do that a few times if you're okay with that. Turn your thumbs up. We're going to start to float the arm up. When the arm comes up, you're not going to hyperextend your elbows. You're going to think about letting the ball drop back in the socket. The arms come up. They can come over your head. I don't want bent elbows now or hyperextended. I want them, they're going to feel like they're in no man's land. Just start to bring the arms up, and you're going to feel like you allow that space to open. If I jam it down, I'm not going to be in a good place. If I'm over tightened in the front of my chest, I'm not going to be in a good place. I'm going to allow the length. I'm going to allow my shoulder blade to come all the way around to the side. I'm going to bring that arm up. It's going to settle back. The shoulder blade's going to settle back, and the arm's going to come back down. So that would be your end exercise. It would take maybe quite a while to work up to that. I would be doing all of my rotator cuff muscle stabilization exercises before I would attempt that if you've got really unstable shoulders. Once you can do the exercises on the floor, then you can start to do them in standing, where you lift and allow everything to move together. So my shoulder blades are moving together, and then I can finally start to take the arms up.